Thanks for tuning into this broadcast. Lots being spoken about testing in India. It is getting ramped up as well. We thought it's best to get in both a perspective on testing currently by private labs, as well as the business impact on some of the pathological labs as well, and diagnostic labs as well. So who better than Dr. Velumani from Thyrocare to join in to talk about this. Dr. Velumani, thanks so much for joining in. This is Neeraj here. Good morning. Would like to bisect this into two parts. One is, of course, the business impact, which will come later on. But first, just an update. Any updates that you have about what is now happening on the ground when it comes to testing? Because I know that the stand or the hope was that the test would be done at 4,500. They've been done for a while. I saw your tweet which said that people were getting tests done, but post the Supreme Court order, maybe things get derailed a bit. What is happening? Is there any conversation with the government to subsidize part or full of this? And how would things move ahead, sir?
Actually, the Supreme Court has made it very clear, and they say that poor cannot pay, make it free. And that's a good decision. The laboratories also welcome that decision. But the government was asked to work out a mechanism, and almost 3 days have gone. Still, mechanism has not been worked out. We don't know whether truly government will reimburse, or if yes, after how many days. So we are a bit reluctant, but then the Supreme Court is supreme. We believe that government will follow, and we believe that reimbursement will come. And those whoever has some kind of cash comforts have gone in, because in this segment, credit is not that simple, because all inputs are highly costly. All vendors look for advance payment. So a day or two, some chaotic approach was there. And yesterday, I think, was a day where I found the high number of swabs collected was highest ever, which says that the SC order has not hampered it. The testing is going on. Laboratories are waiting for government to say their support or whatever mechanism it is. The good news is a lot are tested, but the worry continues. Only rich are going for a test, poor are not going for a test. Only panicked are getting tested, not the ones with symptoms.
Sir, I thought I heard you say, but I just wanted some update there. So is there some conversation that could be going on between a body or a set of entrepreneurs or some medical fraternity which is asking the government to look into possible reimbursements as well? Because I take on board the point. I mean, fair economics would suggest that this would be a big burden on labs, and especially the smaller labs, to conduct these tests free of cost. So is there some conversation going on?
I think this is one industry, though we are 3 listed players, there is no true association, because actually associations are always fighting for benefit of the operators. We fought for the benefit of the consumers. So far we didn't think of representing together. Having said that, for the last 3 days, we are in discussion with all potential influencers, so that the government comes up with whatever they want to come up, they can come up. It will be clear for us. Probably bigger players have some cash strength, poorer players cannot afford. It's a very big stress, and we want government to get us to know what is there that we can do, we should do, and we must do.
Right. Dr. Velumani, good morning. Devina here. So I just wanted to ask you, so this is this particular order by the Supreme Court is well accepted by the industry? There is no recourse?
We were to go and petition in the Supreme Court.
Yeah.
In the last minute, the wisdom said Supreme Court is absolutely right. We must only address the issue to the government of India. And we are doing it. There is nothing wrong in the verdict of the Supreme Court. It is the best possible in the interest of the poor and needy.
All right. So it's not like you are having your counterparties or industry members trying to appeal against this ruling, right?
No. We want more to be tested, and testing most, possibly next 3 months, the most counts will give us a confidence that we have statistics in hand to plan for the future. But having said that, we want the government to clear the doubts in the minds how long to wait. Otherwise, we are very happy about Supreme Court verdict.
Have you, sir, started free testing?
Yeah, we started free testing. The first came in was the richest man because his car was costlier than my car. So even if you give it free, the rich man can reach faster. Poor will take his own time to reach. So I said in the earlier, rich are testing, not poor, and panicked are testing, not the ones with symptoms. This is a bit of concern, but having said that, we are doing our duty.
Yeah. So you also said that in your first answer, you mentioned that those who cannot afford to pay should be, testing should be done for free. So does that imply that if you are able to pay for it, then you go ahead and pay for it, or this is a blanket free testing for one and all?
Cannot take money from anyone till some clarity comes, because we sitting here would not know who is by logical criteria rich or poor. We can't just look at the man's diamond ring and make a call. So it is a matter of mechanism or should be worked out by government. If you ask me personally, all employers should pay for their employees and unemployed should be paid by the government.
Okay, got that. So there's another conversation which is happening on the sidelines, which talks about drive-through testing. Is that something that's come under your foray as well? And what's your take on the drive-through testing?
I'll tell you, very interesting things are happening. The drive-in is only driving in the rich. Unless or otherwise, you can have a bus. In the bus, some 20 people can come in, and you have a drive-in for a bus or a drive-in for a train in a railway platform. You can't reach to the common man. Especially when it is locked down, only people with automobiles can move around. So there are a lot of challenges, not just one or two. This is an unprecedented crisis, and the crisis management at every level is falling short of, and nothing prudently can be worked out. But having said that, over every day we will improve, and government will bring in a better clarity, and it's a matter of time.
Dr. Velumani, just wondering, how is business, how large is the business impact? Because people might be skeptical of turning out for tests, even if they do not have coronavirus symptoms, but have some other issues. Are you facing issues of that nature? Have tests as a percentage gone down substantially, or is it a modest downtick?
I think ye jo Ganti Bajao is a time where people will remember for their entire life in healthcare. Before that, almost I got the highest workload in that week before that. But the next week it became zero. Literally speaking, all the laboratories have only 0 to 5% business of conventional business. All the hospitals have only 0 to 5% conventional business. So healthcare has gone to zero. Only COVID testing is going on. That too with only limited number of players. They also have limited capacities. So there is no way in which you can look at numbers. The balance sheet cannot be done anything within Q1. But having said that, the medical doctors are not sitting in clinic. 90% of them are sitting at home. They are not willing to see the patient, touch the patient, and touch and feel is going to be never there going forward for infections. And telemedicine will be the option. But having said that, let me tell you this, I have mentioned in my tweet, the entire hospital diagnostic industry will split into COVID healthcare and Novid healthcare. And I will use the word Novid, it is non-COVID. You can't manage both patients parallelly together in the same hospital. Gone. So it will be all a new game. It is a reset for everyone. The leaders also have to come back to zero and restart. The intelligent ones, the wiser ones, and the capable ones will move fast. It is an absolute reset, even for healthcare industry.
Right. It is definitely, sir, not just for the healthcare industry, but for all industries at large. It's going to be a major reset. But sir, let me ask you, have the number of tests really gone up in terms of the testing kit? How many tests are you doing per day now? And is there any COVID tests? And is there
Right.
any level or number that private labs are expected to reach to on a daily basis?
I must tell you, unfortunately, scaling up is not that simple. I have the capacity, space, manpower, everything, but in entire capacity, I only have 10% of space allotted for microbiology testing. So I cannot handle more than 400, 500 a day. So we have asked for additional analyzers. It can at the maximum crowd that room with some more analyzers in a limited space. I can't do it in the rest of the 90% space because it is a deadly, dangerous virus. Having said that, we are trying to build extra rooms, extra, in fact, buildings which are unoccupied. We are trying to convert as a processing facility. Trust me, 45 days it will take for it to reach to a stage where we can do the test. And then onwards, it will be the approval processes, which was taking a few months. Now I believe it will be in few days. All players are working at increasing the capacity. And let me tell you, the number of tests done should be 25 times more than a number of cases infected. So you can imagine what bigger number is needed and how to manage entire.
Yeah, but that's going to be a very difficult challenge then to scale up, Mr. Velumani.
Yes,
in terms of getting to that.
Now money will come, patient will come, and balance it can be better, but it is very difficult to really scale up. But let me tell you, there will be one more embarrassment waiting for all the players, especially for the listed. Your balance sheet shows best profit in the time of crisis. It would be very embarrassing.
That's actually my next question. So you said the larger labs will be able to take this burden on in a better fashion than the smaller labs.
Larger labs have IT, HR, logistics capabilities, so they should be able to do it. If given an option, the 10 top labs would occupy 25 cities very fast, scale up very fast, provided they are helped in logistics and helped in approvals earliest. So only big guys can play big games. Small guys certainly will be, for them also it will be sufficient business, local business. There is no one in this space will suffer if government starts reimbursing.
Right. My question was more on the lines of sustainability, business sustainability, and being able to whether through this period of not being able to do the COVID testing versus doing free COVID testing, which also has no impact.
I will tell you, this is a very sad situation today, but we are all very excited because post-coronavirus, the biggest industry will become healthcare industry. Fastest industry to produce better numbers will be healthcare industry. And man is now not worried about anything except health. Man is worried only about immunity. Immunity is the only wealth now people understand. And there is going to be a total new approach. And the Novid business as well as COVID business will continue to be there. I must tell you, COVID business, before arrival of the COVID, microbiology business only was 5% in the industry. At least in another 12 months period, COVID business will be 50-50. That is, Novid versus COVID will be 50-50. To that extent, COVID will grow. To that extent, even Novid will grow.
All right. That's going to be an interesting fact or an interesting change of weightages for most of those private labs. Thanks, Dr. Velumani. Really appreciate you taking all the time and joining in and throwing some light in our conversation here. So that's Dr. Velumani of Thyrocare. It's going to be tough times ahead, but definitely changing the dynamics of the business post-coronavirus. Thank you so much for watching.